Good morning, everyone. Thank you so much for coming to our press conference today. We're here to introduce our bill, Know Your Healthcare Costs Act. This bill is intended to empower patients through price transparency in our healthcare systems. Healthcare is the only thing Wisconsinites purchase that we don't know the price of beforehand. Let me reemphasize that. Healthcare is the only thing Wisconsinites purchase that we don't know the price of beforehand, and that has to change. This bill requires hospitals to make publicly available a machine-readable digital file that contains a list of standard charges for certain services provided by the hospital, as well as a consumer-friendly list of standard charges for certain shoppable services. If this sounds familiar to any of you, it may be because this is already current federal law. This bill mirrors current federal transparency requirements promulgated under President Trump and continued under President Biden. However, it gives our state the ability to enforce the requirements. Under this bill, if a hospital is not in compliance with these transparency requirements, DHS will work with the hospital on a corrective action plan. And if that hospital doesn't respond to the department or comply with the plan, then DHS is given the ability to issue monetary penalties to the non-compliant hospital. With that, I want to turn it over to Dr. Will Flanders from Will.
Thank you very much, Senator. For millions of Americans, tremendous fear comes with any medical procedure that they may be requiring. This fear comes not from the potential risk of the surgery or the medications they may be put on afterwards, but rather from the mountain of debt that will inevitably follow, with almost no clue as to what the total will be. Wisconsin is no exception to this. A recent study from the Rand Corporation found that Wisconsin has the 4th highest healthcare costs in the nation, with patients paying more than 300% of what Medicare pays. The healthcare transparency legislation being announced today is not a silver bullet to solving this huge problem, but it would represent an important step in introducing market forces to the healthcare industry that for too long has almost been fully insulated from them. According to research, about 80% of healthcare services are shoppable. This means that people in need of a particular procedure have the opportunity to look and evaluate prices and determine what would be the right choice for them, evaluating prices as well as the quality of service, if only that information was made available to them. New Hampshire was among the first states to implement price transparency. A study of the initiative in that state found that a significant amount of consumers utilized the services, and there was a significant reduction in costs for both consumers and the insurance industry of about $7.9 million for patients and $36 million for insurers over the time frame of that study. So significant savings can result from this. Our own national study in 2019 found that consumers were more likely to forgo care when cost information was not made available to them. So patients are not seeking out care because they don't know what it will cost them. Some say that the market has failed in healthcare and the only solution is a nationalized system. But the truth is that a free market system has not existed in the healthcare industry for decades, thanks largely to the inaccessibility of information to empower consumers in their decision making. Price transparency is an important first step in altering this paradigm and restoring a sense of normalcy to our out-of-control healthcare costs. Thank you very much, and this time I'll turn it over to Representative Brooks.
Thank you and good morning. This bill, as already discussed, will establish greater price transparency and provide consumers with information necessary to make more informed healthcare decisions. The federal law has not provided to date the necessary guidelines and clarity that we would like to see here in Wisconsin. That is why I've co-sponsored and co-authored this bill. There is indeed nothing more that impacts Wisconsin families more, particularly something that we don't directly purchase, than healthcare. This bill again seeks to provide more information and therefore more choices. Just like everything else in society, healthcare, particularly health insurance, has evolved rapidly. Gone are the days when my father worked at Chrysler Corporation and had a Blue Cross Blue Shield card with no deductible, no real network, no out-of-pocket expenses. Families today are faced with high deductibles. 80% of those deductibles are usually not even met, or HSA plans. So the need to provide additional information to consumers is of utmost importance today here in Wisconsin. And I don't think that's something we want to leave to the federal government. And again, that's why I signed on to this bill. I'm very confident that we can work with the hospital associations and other providers to get compliance with Wisconsin standards and come up with an easily readable system for consumers to make informed decisions. At this point, I'm going to turn it over to Will Walker.
Good morning. Will Walker, Walker Forge. I'm here because I'm an employer and I care about my employees. We have 350 employees in Clintonville, and our company has worked over a number of years to contain healthcare costs so that we can provide great healthcare at affordable costs to our employees. And price transparency is very important. It's important to employers across the state because it's our second or third largest expense on our income statement. And it's important to our employees because they pay for health care in a number of different ways. They pay for it through deductibles, out of pockets. They pay for it through the premiums that are taken out of their paycheck. And they also pay for it through wage increases that they never receive because of the increasing cost of health care. Price transparency is important and necessary. It's necessary if we are ever to have any semblance of a free market for health care. We don't currently have a free market for health care, and evidence of that is the extreme variation in pricing among providers for the very same procedure. We have employees at Walker who have paid $3,000 for a colonoscopy and other employees that have paid $8,000 for a colonoscopy. We have employees that have paid $28,000 for a knee replacement and other employees that have been billed over $50,000 for a knee replacement. When we have price transparency, employers like Walker Forge are going to be in a much better position to educate and provide resources to their employees to help them become better and smarter healthcare consumers. Wisconsin has some of the highest healthcare prices in the country, and the answer to that problem is competition. We need people to shop, but we can't shop unless we have the prices. Next up, Senator Julian Bradley.
Thank you and good morning. Even long before COVID and the COVID inflation that has come since, the rising costs of healthcare have been impacting everybody in this room. Whether you're an elected official, an employer, a reporter, a staff member that you're watching at home, you've been impacted by the high rising costs of healthcare, and people have been looking for solutions. More often than not, those questions about how this should be resolved have been around who should pay, whether it's the hospitals or employees, employers, providers, when the real solution that we can provide immediately is how much is being paid, what the cost is. And that's what this bill does. It helps bring that transparency to light. It helps bring those costs to light. So when we talk about shoppable services, we're not talking about emergency services. We're talking about things that can be scheduled, non-emergency procedures that you can take the time to look forward to get scheduled, and to make the best decision for yourself. That's what this bill does, and that's why this is so important. I want to thank Senator Felskowski for leading this effort here in the Senate, Representative Brooks for leading it in the Assembly. I'm a proud co-author and co-sponsor on this legislation. I represent the 28th Senate District, which is suburban Milwaukee County. Senator Felskowski obviously has the northern part of the state. So this is very evident that this is not an issue that is to any one geographic location, to any one specific type of people. It's everybody. This is something that will impact everybody in a very positive way. I had the great opportunity to visit a surgery center in the heart of my district last year, and it was incredible to find out just how much their patients are saving by having the ability to shop and look for those procedures. So we look forward to getting this bill across the finish line to be able to help our constituents, help the consumers, and help everybody as they try to combat one of the biggest costs that the families are facing. At this time, I'll bring up Senator Felskowski for questions.
So we have time for a couple questions. Do we have any questions from anyone?
The Wisconsin Hospital Association called the legislation unnecessary and said it would complicate and confuse hospitals trying to comply with the existing federal regulation. What's your response to that?
So we have reached out to the Hospital Association. We had a great conversation with them. This mirrors federal legislation, so by complying with one, they would be complying with the other. There might be slight differences, but nothing drastic.
I don't mean this to be flip, but why do it then? Like, if it mirrors federal legislation. Why do you think it's important to take this step?
Because we're not seeing it happening. You know, somebody put a really interesting book on my desk about 2 months ago. It says, "Stop Waiting for Washington." So that's what we've decided to do in this state. And I think it's come to, you know, I've been in this building 10 years. And this was a conversation that was happening 10 years ago. And for 10 years, we've seen no movement on trying to help our constituents deal with the high cost of healthcare. Too many times we have the stories where, you know, somebody doesn't go to the doctor because maybe they have a $10,000 HSA and they're afraid to go because they're afraid of the cost. And then by the time they do go, things are so out of control. Hopefully it's not life-threatening, but the cost is even higher to them and their families. So it's time that the state stepped up and started looking out for our constituents around the cost of healthcare, and that's what this bill does.
So is the issue that the federal government is not enforcing these regulations? Is that, and your bill would enable DHS
Right.
to enforce them?
Right.
Is that really what we're talking about here?
Absolutely, and the point of this bill is not to be punitive. That's not the intent of this bill. The intent of this bill is to get the transparency out there and the costs. And if you look at it, we empower DHS to do corrective action planning with any of the hospitals that would not be compliant and help them get to compliancy. Now, if that goes on too long and the systems are not in compliance, then DHS has the ability to put penalties against the systems.
Can you give like a tangible example of how somebody might use this? I mean, you said it's non-emergency, but like in your mind, what's an example of how someone might use this?
So a lot of it is going to be when you have employers sitting down with to shop their insurance for the upcoming season, correct? And 88% of the lives in the state of Wisconsin are in self-funded plans. So employers are working with consultants to devise those plans. They can take this data, they can download it, and there will be consultants out there that say, hey, these are the networks where you'll save the best money. Here's the quality, here's the cost. So they can utilize that in helping their employees devise plans that best meet those employees' needs. In addition to that, we have companies out there like Turquoise that will take this data, they're third-party providers, and then they can help develop websites where you as, like, say your wife needs a mammogram. She can go out and she can search on there in her area, by her zip code, where is the least cost to find that mammogram. So it will help not only employers devise the health insurance plans that they're offering their employees and help with the lowest costs and the best quality, and it will also help consumers using those third-party websites to find the least expensive procedures out there. Because more and more of our policies, and I'm sure everybody in this room knows, we're going to the high deductible plans where it's no longer that $250 deductible. They're extremely high family deductibles. So this helps them save those dollars and get the quality care that they need.
So if I can, one real life example, I was rear-ended right here on the square by somebody that had no insurance. So I had herniated disc. To go get that procedure and get a spinal injection was ballpark, this is off the top of my head, about $15,000 through a local provider. My doctor, I had 2 of those done. My doctor then left, opened his own clinic. I could get the same procedure done for $1,200 cash. So 2 over there didn't even come close, would have exceeded my deductible, where I could have got the same procedure done for less than 10 cents on the dollar with the same exact doctor, same exact shop. That's the kind of information that would have been handy for me to know, because it's much cheaper for me to pay that out of pocket. Then I can deal with my insurance company is, does that help meet my deductible or not? But even if it doesn't, when most consumers don't meet that 80% deductible, that's a choice I get to make then. Or if I have a health savings account, that's a choice I get to make. So I think it's really important that we have that information.
I want to circle back with one thing too with what Will Walker had stated. When we can lower the price of healthcare and have employers saving dollars and employees saving dollars, that means reinvestment in their companies, reinvestment in their employees, wages going up. You know, so it's helping our constituents dealing with the high cost of healthcare, and that's what the primary point of this piece of legislation is.